is, is sauna good for you? That's not the question. The question is, do you have the adaptive capacity to be able to benefit from the sauna? Is really the question.
Okay. Okay, okay, okay. Awesome. And so, I mean, I'm going to come back to them. There's someone else asking about how do you make the nervous system calmer? How do you get out of fight and flight and that kind of stuff? But I will come back to that because I do want to ask this because I have a client that is on and she asked me to ask you this question. So this is not doesn't have to do with the nervous system. It actually has to do with is surgery required to remove two small cysts from kidneys? Been the same size for a couple of years. It's a 36-year-old female. Had them checked with contrast 2 times this year, but will now need it about every 6 months. So the contrast is what is concerning. So from a biomed perspective, what would you say to someone that is, trying to find mm, other options?
First of all, we're not with, if we have two cysts, we're not talking polycystic kidney disease. Polycystic kidney disease is a genetic, hereditary thing where over a period of time, more and more of the kidney loses its normal functioning because the normal tissue is replaced by a cyst that basically has non-functional nephrons in general. I would say in general, if you have two cysts and a 36, I don't personally would even consider that an issue because having looked at literally tens of hundreds, if not thousands, of these type of pictures, it's not uncommon to see people say, "Oh, I have a cyst in my liver. I have cysts in my kidneys." The if you have normal kidney function, not just from your creatine level, not just from your BUN level, not just from your GFR, but actually true. If somebody's really concerned about it, you need to ask your doctor to do a test called cystatin, the better measure of how good your kidney function is. And if your kidney function is not declined, instead of doing imaging, they should just be measuring your kidney function. And if you have good kidney function, why are we doing contrast media per se to see? I mean, are they considering that it's cancer, which I would assume since they're doing contrast? But cysts are, in all honesty, they're a dime a dozen. I see it all the time. I see it routinely. It almost, somebody, if, five people were to bring me an image for whatever reason, maybe the chiropractor did it and said, "Oh, by the way, you have a couple of cysts in your kidney." I'd say, "Yeah, lo and behold, and so does a lot of other people. So let's not worry about it if you have normal kidney function."
Okay, awesome. Thank you. And then I want to answer this one. So, mouth taping claims to activate your vagus nerve for better sleep. So, we've been talking about sleep. So, is there anything to that? And where does it cross into a risky territory?
Big no, it is not. It is not. Wrong question. It is not a vagus therapy.
Okay.
Mouth taping is not about the vagus nerve.
Okay.
Mouth taping is about breathing.
Right.
Now, breathing. So, in a secondary aspect, because obviously we're doing mouth taping, what we're then doing is we're making nasal breathing, which is very positive and may have a secondary impact because if you're breathing only through your nose at night, and it's basically in a calm area, it will create the physiologic environment as far as the brain is concerned, which will allow your body to be able to regulate itself so that you can have more stable sleep. And typically, you'll wake up feeling much more refreshed in general. This is a therapy, interesting, that allows you to be able to predict safety. It's not so much about adaptation. I'm a fan of recommending mouth taping because and so like most of the therapies people will ask about, the therapies themselves are not doing the healing. What the therapies are doing, whether it's mouth taping or icing or sauna or ozone or whatever it is that people are doing, or PMF, whatever, what they're simply doing is they're removing barriers so that normal physiology of how your body is supposed to work can do what it's supposed to do. So, whether you, depending on, some of you may not know, but I've been a huge fan of using Lunda numbers, which are homeopathic remedies. I use phytogens, I use cell salts, I use single remedies, et cetera, et cetera. Those remedies, people say, well, they're doing something. No, they're creating an environment so that the body's own physiology will be able to do something. And so we would say the same type thing about mouth taping. Now, so what is it doing? So if somebody has sort of chronic nasal obstruction, chronic sinus problems, they have obstructive sleep apnea, they're probably not the best candidate to do that. So the relatively easy test is if a person can sit comfortably for 5 to 10 minutes and not have to breathe through their mouth when they're awake, they probably can do just fine doing mouth taping. But if you feel that you have to be breathing through your mouth on an everyday basis without thinking about your nose and breathing nasally, then they're not going to be a good candidate. And from our stoplight model, it's more likely the red patients that probably would be suspect and would not be good candidates, because that would probably just create for them another stressor, which is exactly the last thing we want to be doing at nighttime for those people. So I'm a huge fan of it. I think it's a very helpful therapy for a vast number of people, but not for people who either have sinus, chronic congestion. They already have been told that they stop breathing at different times. So those are the areas that need to be focused on first before you delve into the idea of mouth. But it's a great therapy for what it's doing. So and so for people who do mouth breathing, of course, they wake up, their mouth is dry, they have to drink some water in the morning. Uh, in general, so it does help snoring and can help snoring. It can prevent people from hyperventilating at different times. So there's some really positive things that come with it, because when you do nasal breathing, it usually promotes you to breathe slower. And it reduces the fact that you are taking in a lot of air. And people will often say, "Oh God, I wake up and my belly's bloated." It's like, yeah, because you literally been swallowing air and not just breathing air in the morning. So I mean, there's like everything, you think of it from a physiology perspective, not from the question of is it good or bad. It's like, how can your body tolerate it? So the question about vagal tone, in an indirect way, if you can successfully do nasal breathing, then in an indirect way, you will support a relaxation of your vagus nerve, and that's a good thing.
Okay. So it's possibly that you could do mouth taping during the day as well. You don't have to do it while you sleep. So that's how you can start training. So when I used to work on my breathing and whatnot, I actually used to tape my mouth when I'd work out to force the nose to breathe. So then it helped me stay within my physiology, so I didn't train outside my window of capacity and stuff. So that was something that I used to do a long time ago. And people were like, "What are you doing?" So you'd see me with like tape on my mouth while I was working out and whatnot. But I mean, that's a kind of extreme a bit, but it was just definitely training, something that I was doing to work on my ability to breathe and work on the oxygen in my body and whatnot. Like you see all these different masks, but that's another suggestion. Okay, so I got one more of these questions, and then we'll come to the nervous system. How do you make it calmer? We'll finish off with that one. So a lot of influencers are saying, particularly on TikTok, some and Instagram, I guess, influencers are saying that icing your neck can instantly calm your nervous system. Is that legit, or is that another oversimplified hack?
That's way, way oversimplified. That is not. That's not a good idea. Well, I shouldn't say that. It depends. Once again, if you're green, it's probably fine. Because once again, the question is, does your physiology allow and what is the intensity of the cold exposure? Because it's pretty obvious that when you get exposed to cold, it's a stress. Your body interprets that as being a stress in general, especially if it's because what you're doing is you're initiating skin cold receptors. It's like when it's wintertime or whatever, your sympathetic nervous system will increase briefly. Obviously, when put cold on, your blood vessels constrict and your heart rate raises. I mean, that's the physiology of what happens, which means, okay, this is a stress. So, but we have two possibilities. So, cold itself is a sympathetic stress. We hear all the time. But what if we splash cool water on our face in the morning or on our neck? Because that has the potential of doing vagal activation. So timing becomes a big issue here. So the I would classify, or I would think of icing or putting ice on the neck as just being another physiologic stimulus. So now the question comes back to what
Why
what
do you need it?
stoplight are you at? So how does your nervous system interpret that cold stimulus? So if you're in a green stoplight, this brief sympathetic you'll get brief sympathetic activation, as I just said, and you get a bit of a parasympathetic rebound. If you're a red patient, you potentially could cause you to have a headache. You could get a sore neck. Your nervous system goes on in more vigilance. It's actually uncomfortable to do. So the bigger thing about cold is the exposure. So splashing cool water for 20 seconds is a very different impact than doing an ice bath or putting ice on your neck for 10 minutes. So the dosing is a big factor, and the state that your own physiology is in is really the determining component for what it is. So fortunately, I on these TikTok or whatever, on Instagram, wherever it's showing up, um, people will then do this and then say, well, that didn't help me at all. In fact, it made me worse. So the question, once again, is not, um, is this a good or bad therapy? The question is, how does the nervous system interpret what is happening? So does it interpret it as a stimulus, as basically safe, and you'll be able to recover from it? Or does it put you into a place of, uh, shock almost? So the right physiologic stimulus for the patient who has the proper adaptive capacity, it's a reasonable therapy. But once again, it's not. Does the answer is no, it doesn't.
Okay. So what do you say to someone who's been practicing all these things that like, so practicing pausing, real regulation, stress management, it feels good in the moment. And when they go back to their daily life, their body defaults to fight flight. And so it's obviously frustrating and exhausting. So what do you have to say to that person? So other than they're living, they don't have capacity to hold. So that's the obvious answer. Their phase angle is too low. But what else would you say to this person?
If you need an objective measure, all you need to do is test your nervous system, and it'll show you what's happening. Uh, it's like if you either you can trust somebody who's saying something on social media, or you can actually look at the real science that is what I just basically am trying to relate to you. I'm not telling you should or shouldn't do it. I'm telling you the people who would benefit. I'm telling you the people who won't benefit, and the reason that you do it. If such that so the question would be, without knowing the individual, you'd say, so if you go back to baseline, and whatever benefit you got from doing it is not there, for hours later, and it's not there the next day, in fact you feel worse or not as good, or you have a headache or whatever it is that comes up, are you getting symptoms that you think is related to something else, when we know it's the therapy that's actually putting your body into more of a stress state than it is a recovery or relaxation state? So, and what I say to all my patients, this is my suggestion. Whether you choose to do it or not is your choice. I mean, I can't do that. I can't do it for you. You ask me for advice. I give you my advice based on what I know clinically, and from looking at your results. Just like the gentleman I mentioned earlier, when you tell somebody who's been meditating for 2 hours for 30 years to suddenly say, I don't think that's a good activity for you. It doesn't mean you stop doing it, but how about if you do it for 1 hour and then spend the second hour outside in nature receiving energy, as opposed to forcing yourself to perform during the 2 hours?
Perfect. Yeah. So it's just when, if you can't hold, so if you go to massage and you feel good the day after, or you feel good in the moment, and then the next day you're stiff, you're sore, or if you go to a chiro appointment and you get an adjustment and it holds for a couple days and you lose it, if like go do a therapy and you feel good in the moment, but you can't hold it the next day, what's happening is your physiology is not holding it. That's the reality. Like your phase angle isn't high enough. You don't have enough capacity for you to hold that therapy, so you may have to back off a little bit, like my dad is saying. You might have to try something different because your body is not holding it physiologically. And that took me, oh my God, a long time to figure out. And this is the thing. So it's this constant, it's not a pivot, it's just the readjustment. And when you can test it, because we can actually test where your phase angle is. We can actually test, like I actually had three clients that went and got their phase angles done at these different gyms, and or they'd use an in-body, that kind of stuff. Anyway, and the trainer and the person that they worked with, they're like, oh, they just skipped over phase angle. They had no idea what that number actually meant. And so my clients are asking, like, tell me about my phase angle. How am I doing? And they're like, oh, we don't need to know that number, but your body fat says this and your da da da. So I think it's just a matter of, we need to help educate and help people understand, like, there are key numbers. Like, you should know what your SDNN number is. You should know, what your tension index is. Like, and so tension index is how hard is your nervous system gripping. So like this gentleman who's meditating, when he lies down, his nervous system's gripping, even though he's doing something good. That's been my whole, like, you can look at my whole Instagram page. It's all good stuff. It's all about timing. And when we can now assess your nervous system, it's really about knowing what timing is best for you. So all therapies work. We've said that forever. Is just which one is best for you right now. So one person said, like, these suggestions are great, Dad, but the it's finding the root cause. So we did talk about root cause a little bit before in like last week and the week before. So do you want to speak to that? Like, what's the real root cause from a physiology? Like, so why do people not hold things? Why do people not respond? Why are some people in red, some people in green, some people in yellow? What's the root cause for you?
The root cause is a lifestyle to everything that came up before when they come in. So it's like, how has their body learned to adapt from literally the moment that they were conceived into their 30, 40, 50, or however old they are. And because everything is about adaptation, everything is about, sort of how, the language we speak is because we were raised with English parents. And so we spoke English in general. So the symptoms that people experience are not because you're lacking something. It's because your body is either not feeling safe. You just talked about phase angle. You don't have enough battery power to be able to cope with what's going on. So because of the number one function of the nervous system is to allow you to survive. I mean, that's really the bottom line. It's about survival. So it will do anything that it can and does in order to you be able to survive another day, so to speak, in general. So what is the root cause? The root cause simply is you don't have the proper. Your body doesn't feel safe. You don't have enough battery power. Your nervous system is not able to regulate your 13 organ systems into a reasonable aspect. And so the analogy is, think of each organ system as one section of a different orchestra. And when some one of the organs is out of balance, let's say you have digestive problems, or you have your cardiac, you have high blood pressure, or your urinary system doesn't work well, or your gastrointestinal system doesn't work well. So then you go to the specialist and they focus on that one system. And I say, so if this was an orchestra playing and the string section suddenly wasn't working well, would you just go to somebody who is a master of the string section, or would you say, I think we need to talk to the conductor and figure out how does the conductor get all this thing working? So we need to get the nervous system in tune. So we need to get all the organ systems in tune. That's what regulation is all about. And when our body is unable to regulate, then another system. So if the strings are not getting the conductor's attention, then the next thing that'll happen is the horn section will suddenly not sounding properly. And as time goes on and we have more and more issues, we have more and more organ systems out of balance, that orchestra doesn't sound very good when they're playing whatever tune that they're playing. We want everybody working together. We want all the organ systems regulated. We want to have enough battery power. The analogy I'm using, think of every morning that somebody is giving you $100 and you have $100 to spend as far as your energy is concerned for the whole day. And a couple of weeks ago, I had a young lady who, for 6 days a week, goes to the gym gets up at 5:30 and goes to the gym for an hour. And then she wonders why at 2 o'clock she's like exhausted, per se. I said, well, you're spending $120 in the first hour of the day. How do you expect to have anything left for the rest of the day? So if you want to go to the gym, go 3 times a week and go for half an hour instead of an hour and build up your reserve. And once you build up your reserve, once all the instruments in your orchestra are playing the same tune, once you have built up some of your battery power, your body will be much easier to adapt whatever therapy that you choose to do, whether it's the sauna or the icing, which once again they're not doing what the question was. They're actually trying to impact the physiology of the body. Everything is about physiology. No matter what condition that you have, if you ask the question differently, the question isn't what's the therapy, what's the diagnosis. If you go to a conventional doctor, they'll say, what's the diagnosis? You go to a functional doctor and say, well, we're going to do all these fancy tests. We're going to find out what the function is wrong. You still have asked the right question. The question is, why can my body not adapt to whatever it is that of what the challenge is? If you just start asking yourself that question, you'll sort of step back and say, just like the first question about sleep, what do you do if you wake up? It's a wrong question. We don't ask that question anymore. We ask, why is your body not capable of allowing you to keep sleeping? And when you start looking at the issue from that perspective, you start realizing, okay, what is my nervous system doing at time or not doing at time? And unfortunately, if you don't have access to doing the testing, if you're having a symptom, if you could talk to somebody with a little bit of knowledge in this. Not every one of my patients is local to Scottsdale, per se, but I've done enough of these now. I can pretty much guess where they're at and how aggressive we can be with the therapy.
Perfect. So we'll finish off with the last question. What tests are we talking about? Where can people find out their numbers?
We're talking the bioimpedance electrical, body analysis, and we're talking Nerve Express, specifically HRV. And people say, well, I'm doing HRV with a Whoop or a Fitbit or an Apple Watch or the Welltori app, and those are great. They give you some information, but from a medical perspective, they don't give us enough information. In fact, in some cases, I'll say, it tells you how your sleep was. If you had any, this guy I'm talking about, he only has about 20, 30, 40 minutes of deep sleep. I said, yeah, it's because you don't sleep. I mean, you're never not in sympathetic. Even when you're meditating, you're not in relaxation. So it's changing that aspect. So, if you can go on the website, um, drainage.biomed, or is it biomed.drainage?
Biomed-drainage.org.
Yeah. So on that site, there is a map on one of the pages somewhere that basically shows you around the country, Canada and the US. Unfortunately, if you're in Australia or some other country, I don't have an answer for you. But on this continent, there are practitioners that I've trained around the country, and I'll be training some more, hopefully, in September when we do our next course, that people will be somewhat familiar. And the goal is that wherever you live, is to start asking your practitioners that, why don't you test my nervous system? Why don't you test my body structure? Why can't you tell me what my phase angle is? Because it's actually a more important number than your cholesterol number is, or your blood sugar number is, in all honesty, from our perspective.
Perfect. We'll leave it at that because it's another wonderful episode of Spill the Tea with Dr. T. So thank you all for watching. Thank you all for participating and asking your questions. Your engagement is definitely helpful, and it's about, we're just here to help share the I'm going to ask those questions. Awesome. Fantastic. It's about changing your perception and maybe asking a different question. So that's the big thing today. If you leave here and you just got to this point, definitely start asking different questions and start looking for people at biomed-drainage.org. You can see who's available. And like I said, September 19th and 20th, if you have a practitioner that you would like them to get trained to learn how to do these numbers and to do the tests, my dad's out there. He's doing the stuff. He's sticking around. He should be retiring, but he's not. He's sticking around to help educate us on how to get these tests and how to help people biologically. So thanks so much. Thanks again, Dad. It's always great chatting with you, and we'll see you next time.
All right. Talk in a week. Bye
Yep.
bye.
See you next week.